Welcome, everyone. Thanks for joining us and learning how your school can gain control of health plan costs. Please note the presentation slides will be emailed to all participants by tomorrow. At the bottom of your screen, you'll see several widgets for your use during the presentation. For example, if you have a question, please click the purple Q&A icon to the left, and one of our experts will reply via email. At the end of the session, we would love for you to complete our brief survey by using the teal webinar feedback widget to the right. Speaking today is Andy Neary, National Advisor to Captivated Health. Captivated, in conjunction with Corporate Synergies, delivers healthcare solutions focused on the specific needs of independent schools. Their innovative strategies have proven to successfully mitigate tuition leaks caused by out-of-control rising health costs. And joining him today is Dean Seidel, CFO of Tower School, to provide relevant real-world insights on his experiences with the Captivated Health platform. At this time, I will turn it over to Andy.
Good morning, everybody. Thank you for attending the webinar. Let's kick this off by level setting. Healthcare is the biggest financial threat our country faces. And when you look at the cost of health insurance, it has far outpaced both wages and inflation. And in fact, it's far outpaced school tuitions for most private schools as well. And it's health insurance costs that have been a direct beneficiary of what is going on inside the healthcare system. So how have we allowed the healthcare system to have such a huge impact on our health insurance costs? Now, we could spend all morning on this topic, but there's one subject I want to focus on, and that's the decisions that are made during the health insurance buying process. For most schools, the first decision starts with picking the insurance company. And if you're buying in the fully insured market, it's typically the insurance company that is offering the lowest premium. Then we look at the network of providers and hospitals to make sure that it adequately covers our faculty and staff. And then we go about picking our deductibles, our out-of-pocket limits, and our copays from a list of plans that the insurance company offers. However, as insurance costs continue to rise, what do most schools do? We shift the burden, right? We raise deductibles. We raise out-of-pocket limits. We get rid of coinsurance. We ask our employees to pay more. Heck, we might fire one insurance company in favor for another. However, this strategy has us ignoring the real problem. And here it is. Health insurance is expensive because health care is expensive. In our efforts to mitigate rising health insurance costs, we are ignoring the biggest problem inside the health plan. The problem is not the plan design. The problem is not even the insurance company. The biggest problem inside the health plan today is the experience your faculty and staff are having inside the healthcare system. And here's why you should be very concerned about that. What you and your administrative team view as a medical ID card, your faculty and staff are viewing as an unlimited school credit card. And here's what's happening inside your health plan today. With this unlimited school credit card in hand, faculty and staff are navigating the healthcare system where the variance in price and quality are enormous. And as long as they stay in network, they can go wherever they want and they can spend whatever they want. And it's these decisions made inside the healthcare system that are the driving force behind the unsustainable rise in health insurance costs most private schools are facing today. So as your school's business officer or human resources director, what can you do about it? Well, with that, I'd like to introduce Dean Seidel of the Tower School, and he will give you his perspective as a business officer of a member school inside Captivated Health.
Thanks, Andy, and it's good to be with you all today and share a little bit about my experience and Tower's experience as it relates to Captivated Health. The slide that Andy shared about the unsustainable financial path, as shocking as those numbers are, I don't think is a big surprise to many of us. We've been experiencing basically the impact of that slide for some time now, as we've seen medical insurance increase at a much higher rate even than our own tuition rates. We've used all the methods that Andy talked about in changing deductibles and moving copays and so on to try to manage this cost, but we've really allowed the medical insurance premiums and the insurance companies to drive that process, as Andy noted, and it's actually been happening to us. In no other area of our budgets do we allow the vendors to be managing and controlling how we spend our money and what the increases might be. We've tried some other creative ways. I mean, ASNE, the group that I'm part of, we were part of a group plan that was buying insurance, and that worked for a little while as we were able to share risk and use a larger group for some bargaining power, but those advantages eventually fell off with a lot of the changes with the ACA and basically unbalanced control, as some schools controlled their costs really well and others didn't. And as Andy noted, health insurance is expensive because health care is expensive, so if we're not able to control health care costs, we're really not managing our budgets and that cost in any way. So as we've looked at the captive from our perspective as a school, we found what we really looked at to be sort of the best of all worlds. And so let's look at what that financial model looks like. So in the captive financial model, we look at risk and frequency of use in 3 different levels in 3 different areas. And we look at ways to manage those risks differently. So let's look at those 3 areas. So in the area, this lowest level, this predictable risk layer, where the most of our health care happens, where the nicks and scrapes and minor broken bones and procedures and x-rays and imaging and all those kinds of things that happen to our and with our employees using the healthcare system are all in that lower layer of what we want to call retained risk. And we want to retain that risk because it's predictable and because we can manage it. We can impact the potential cost of those services that our employees engage in through the tools that we provide through Captivated Health. And that risk layer for each school can be a little bit different, but it ranges between $25,000 and $50,000 per employee. And then as part of this best of all worlds model, we get a shared layer of risk. I think independent schools are especially good at the collaboration as it relates to finance and business office, and we enjoy being part of a group, and we understand the value of sharing risk across a broader group of both employees and members within a plan. And so this shared layer of risk, which is between the lower layer and $250,000 per employee, is a layer of risk that's shared across all the schools that are part of the captive. The interesting thing to note about Captivated Health is that we are a group of only independent schools, educational institutions. So we understand the risk that we are sharing. We understand the risk that we're bearing. And it's similar risk across all of the schools. So we're not mixing risk pools with other pools of risk, whether they be construction or accounting or whatever other industry you want to look at. We're sticking to the risk that we understand and that we know and that we can manage. And then the top layer of risk is that very unpredictable, high claim, high number of cost risk, and that we want to transfer. And so we have a coinsurance plan, basically, a reinsurance plan that we roll that out to an insurance company to cover 100% of that cost. So these 3 layers basically allow us to manage our health care in a way that helps us control the most predictable, share the midterm risk with other folks so that when we have a bad year, they help us cover that. When they have a bad year, we help them cover that, and transfer the risk that we know is basically unpredictable and uncoverable across the span of our medical use. So why does this model matter, and how does it really help us with the management of what can be our second or third highest budget item within the context of our operating budgets? The advantages, I think, are pretty clear, and the need to impact future rates is the biggest piece, I think, of the Captivated Health puzzle, and the ability to impact the rates that will most impact our individual costs as a school based on that retained layer of risk and the management of that retained layer, I think is vitally important to the way that the financial model is set up. The transparency that we get, the data that we get about our claims, now of course we don't get individual data on individual employees and what's going on, but we get group data and we get specific data on costs. So for example, I'll just use the pharmacy plan as one example. In the old group fully insured model, we would get data as it related to all the schools that were in the group. but we never got individual data for our own school. So the marketing or the publications that we would put out to employees, the education we would do with employees would be relative to the whole group. Now I have the ability as a school CFO or an HR professional to look at the data that I'm getting from Captivated Health and actually market that to my specific employees. So, for example, at the end of our first year, we get a list of what Captivated Health called opportunities lost. And they would send us or have a conversation with us about either places where we were receiving services or pharmacy opportunities that we weren't taking advantage of the tools that the plan provided. And pharmacy is a big part of that. And so now I have an ability, say, with the 5 or 6 drugs that I know my people are using, to market directly to those drugs and uses and try to get those folks to move over to a better cost savings option through the RX plan or the other tools that they offer. Captivated Health also offers a number of tools relative to cost and quality, facility and services, and that can also help us manage those costs. So the transparency is big. The tools and resources, which Andy will get into in a minute, are also important because our people need it to be easy. If the employees can't access the information to make those choices, then it really doesn't matter that that's available. So we need to make that easy for them to get to. No long-term commitment. The contracts with Captivated Health are written in such a way that you can get out and choose to go to a different plan if you want to without a financial obligation. We have rollout protections so that plans and expenses that come to the plan after you would leave get covered by the plan. So that's really important as well. And then we also really like the idea of sharing and transferring the risk. We enjoyed being part of a group. We felt like that was beneficial over time, but needed that stronger control over that retained layer. And then the advantage, each state has a different set of regulations relative to the total upside. So your full risk as a school is not the number of employees on the plan times that retained layer. There's a limit that each state places on that. In Massachusetts, it's a 20% deviation. So when the underwriters write your plan and they tell you what your expected claims are, the most that you could ever pay in any given year is going to be that expected plus whatever that deviation number is. And so for us, that'd be 20%. And then I could set my working rates or my premiums based within that range of either expected to that max. Disadvantages, there aren't many. Early on in the plan, where you haven't had a chance to sort of build reserves through savings, if you happen to have that 1 in 5 bad year early on in your experience, you've got to be sure that you're able to fund that plan. And then there's a little bit more administrative responsibility up front. There's paperwork that you're signing, both as the time, it's sort of like mortgaging a house originally in the context of the amount of paperwork. The Captivated Health has done a nice job of getting that organized in a way that can walk you through it so that you understand what it is you're committing to, et cetera. And then some annual renewal paperwork, but nothing that is really that much more than the fully insured group plan that you're currently part of. Over the last few years, as you can see from this graph, Captivated Health has really grown from its original 10 schools. We're now at 30 schools. We're in 6 different states and continue to grow. The other nice part about the Captivated financial model is that there's no state border limitations. So we can go across the entire country offering this plan to other schools and gain a broader risk sharing in that middle layer. The larger that middle layer is, the more risk that we're able to spread out and to share across multiple schools and multiple members. So there's a lot of value for us as members within the plan to help it grow because we want that to be a stronger base that can then support that shared layer of risk. There's also some significance in sharing the cost of even the transferring of risk. As you get a larger pool of people, that's an easier computation and we can get some savings even in the transferring of that high-level risk as well. So growth is important to the plan. Here you can see a list of the current members' schools, the 30 schools that are currently in Captivated Health. Captivated Health, over its 4-year history, has only lost 1 school to leaving the plan and 1 school that actually merged with another member school to become 1 school. Other than that, all the members have stayed in for their entire time as they've experienced some pretty positive results within Captivated Health. So you can see we've got a pretty strong membership, some schools that you might recognize who are also part of the plan, who are trying to do something to help manage their medical insurance costs in a really positive and effective way. At this time, I'd like to turn it back to Andy, who's going to talk a little bit about the principles of our plan and then give you an example of how this might work for one of your employees.
Thanks, Dean. Now, before we get into the experience that Captivated Health can create for your faculty and staff, let's look at the foundation of this community of independent schools and look at the principles that guide what this community does. Number one, it's about the members. We have built a health program designed to help your faculty and staff have a better experience inside the healthcare system. But to do that, we've got to ensure that their decision-making is effective and easy. Number two is consumerism. Every independent school that enters the Captivated Health community offers their faculty and staff consumer-driven health plans that are paired with either a health savings account or a health reimbursement arrangement. And people ask, okay, why do we have to do that? Well, it's very simple. If we're going to get your faculty and staff engaged with the healthcare decisions that they're making, consumer-driven health plans give us the best opportunity to do that. If we allow and continue to allow our faculty and staff to have $15 and $20 copays, they will not care where they go and how much they pay for the service, because at the end of the day, it's only costing them $15 or $20. The third guiding principle is health and well-being. And we really hone in on the word well-being. What we're focusing on here is the entire individual. We're focused on physical health, financial health, workplace health, community health, and mind and spirit. And here at Captivated Health, we truly feel that when we can focus on the entire individual, that helps our independent schools attract and retain top talent, which only increases their likelihood of attracting more students to their independent school. And the fourth guiding principle is governance. Every independent school that's inside the Captivated Health community helps govern the program. Every independent school, regardless of size, has an equal vote and an equal voice, and that's very important for you to realize when you are considering entering the Captivated Health community. Now let's take a look at the experience your faculty and staff can have inside Captivated Health. So I thought the best way to do this would be to tell a story. So we're going to talk about Joe the consumer. Now, before we get into Joe's experience inside Captivated Health, let's take a look at Joe's experience inside the traditional health plan today. First, Joe's school gives him access to a high-deductible health plan with a $2,000 deductible, has 100% coinsurance in-network after the deductible is met, and they provide Joe with $1,000 into his HSA account each and every year. Now, let's look at what could very well be the typical year in Joe's life. First, this health plan gives Joe access to a really big PPO network. And as a result, Joe has to navigate this network on his own, where there's a huge variance in price and quality. And let's remember, folks, Joe's walking around holding this unlimited school credit card in his hand. So first, Joe has a chronic disease known as multiple sclerosis. And as a result, he has to take a drug called Tecfidera on a monthly basis. Annually, that drug, Tecfidera, runs just short of $69,000. Now, later that year, Joe injured his shoulder playing in a pickup basketball game. So he makes an appointment with a physical therapist who then refers him to an orthopedic surgeon. And the orthopedic surgeon runs an MRI on Joe's shoulder. And the contracted price for that MRI is $2,056. And the orthopedic surgeon looks at the image and says, Joe, you definitely have a torn rotator cuff. And I recommend that you come back to the hospital in 2 weeks. We open you up and we repair the rotator cuff. So 2 weeks later, Joe comes back and has his shoulder repaired. And the contracted price for the surgery at the hospital is $12,140. So at the end of the year, Joe sustained $82,888 in health care claims. The vast majority of it, $80,880, being paid by his school's health plan. And at the end of the year, Joe paid and hit his $2,000 deductible, $1,000 of it coming from the $1,000 sitting in his HSA account. And remember, folks, at the end of the day, Joe had to navigate the healthcare system on his own. So when we sought to build a different healthcare experience for the faculty and staff inside Captivated Health, the first thing we had to do was make the decision-making easy. So all of the tools and resources we have built into Captivated Health, we are literally putting in the palms of your faculty and staff. The second thing we had to do is we had to make sure we were putting the right tools and solutions into the health program. So to give you an analogy, let's look at the game of golf. In the game of golf, you need a bag and a set of clubs to play a round of golf. And when you go out and you play that round of golf, the shot you are faced with dictates the club you use. So in designing the program for Captivated Health, we knew we had to bring our independent schools a golf bag, a health plan. And we had to fill that golf bag with the right set of golf clubs, the right tools and resources. So when faculty and staff had to go out and play a round of healthcare, they had the right tool and solution to use based on the healthcare need they have. So now let's go back and look at that same year Joe just had, but now as a member of the Captivated Health community. First, remember Joe is taking Tecfidera to treat his multiple sclerosis, and inside the traditional health plan, he's filling that prescription at the local pharmacy for a cost of just shy of $69,000 a year. Again, Joe's going to hit his $2,000 out of pocket, and his plan is going to pay the other $66,692. Well, now as a member of the Captivated Health community, Joe has access to a chronic medication program where he can access the same drug, Tecfidera, not at an annual cost of $68,000, but at a cost of less than $17,000. And as a result, his school is going to reward him by paying the entire cost of the medication. Now, you might be sitting there saying, okay, how is this possible? Well, Tecfidera is a drug among many drugs that are manufactured in Tier 1 English-speaking countries. And Tier 1 is a phrase coined by the federal government here in the United States for countries whose drug standards are at or better than they are here in the United States. And the difference between those countries and what we do here in the United States is they negotiate the prices of their drugs. And Tecfidera happens to be manufactured in one of these Tier 1 English-speaking countries. So Joe can now access this medication for a fractional cost of what he's paying inside the traditional plan. And as a reward, his health plan is going to pay the entire cost of his Tecfidera. So at the end of the day, Joe still gets his medication, he saves himself $2,000, and his health plan saves over $50,000 even after paying the entire cost of the medication. Now remember, later that year, Joe injured his shoulder playing in a pickup basketball game. And inside the traditional plan, that MRI he had run through his traditional plan at the local hospital had a contracted cost of $2,056. Now, Joe had already used up his $2,000 earlier in the year on his Tecfidera, so his health plan, his school's health plan, ends up paying the entire cost of that MRI. Well, now inside the Captivated Health community, Joe has another golf club, another option to pull out of his golf bag to help him make healthcare decisions effectively. Inside Captivated Health, he has the ability to access a program known as Tandem Care. And when Joe's told he should have an MRI, he can get a hold of an advocate who can help Joe locate an MRI at the same quality, just at a different facility where the contracted price is not $2,056, it's $470. And as a reward, Joe's employer is going to put an extra $200 back into his health savings account. So at the end of the day, Joe gets his MRI. He pays $470 of that MRI out of his deductible, of which he uses his health savings account dollars. In addition, he earns an additional $200 into his HSA for making this choice, and he saves his health plan $1,856, a win for Joe and a win for his school's health plan. Now, what about that surgery that Joe had on his shoulder to repair his rotator cuff? Again, under the traditional plan, Joe had that procedure done at Hospital A, where the contracted cost was $12,140. Again, he hit his out-of-pocket months ago, so his health plan paid the entire cost of that surgery. Well, now as a member of the Captivated Health community, Joe has access, again, to tools and resources that can actually help him have that same procedure done, by the same surgeon, just at a different facility, where the contracted cost is not $12,140, it's $2,536. And here's the beautiful thing. Joe does end up using the remainder of his deductible, which is $1,530. He also uses $730 remaining in his HSA account to offset his deductible. But his health plan only has to pay $1,006 for the procedure. And as a reward, his employer tells Joe that they're going to share 25% of the savings Joe just created with Joe. So at the end of the day, Joe has his shoulder repaired by the same surgeon. Joe actually earns $870, $871 to be exact, and his health plan saves $8,730. So at the end of the year, Joe was able to fill his same prescription of Tecfidera for the low cost of $16,674. Joe was able to get his MRI at a contracted price of $470, and Joe was still able to have his shoulder repaired by the same surgeon at a different facility for $2,536, for a grand total of $19,680, saving his health plan over $60,000. And at the end of the day, Joe paid $800 out of his own pocket, $1,200 from his health savings account, and through his surgery, he earned $2,401. Yes, you're reading this right. At the end of the year, Joe actually made $401 from his health plan. Now here's the thing. The tools and resources that have been built into the Captivated Health community work. However, if faculty and staff don't know how to use those tools and resources, nor do they remember that they have the tools and resources, they're useless. So how do we get faculty and staff to get engaged with the tools we are providing? Well, let's go back to that golf analogy. Professional golfers play with pretty much the same golf bags and the same set of clubs that we amateurs do, but they have access to one additional tool we don't have, and that's a caddy. And the caddy's job is to help the golfer determine which club to use based on the shot. So we have built a healthcare caddy into Captivated Health to help your faculty and staff determine which tool to use based on the healthcare need they have. It's as simple as one app, one phone number, one call. So when you focus on the healthcare experience your faculty and staff are having and you allow them to make decisions effective and easy, you not only reduce the frustration they have inside the system, you can now begin reducing the cost of your health insurance program. So as an independent school, why would you want to become a part of the Captivated Health community? Well, number one, you have transparency. You see every dollar that you spend inside the program because you're part of a partially self-funded program. Number two, you have control. Again, being partially self-funded, you now can control the future trend of your health insurance costs. You're no longer at the mercy of the fully insured health insurance companies and the decisions they make about your renewals each and every year. And last, but probably most important, is you have stability. You're now joining a community of like-minded independent schools who are all out to create the same outcome. Here at Captivated Health, we are excited about creating a 21st century culture of health and well-being, and we would love to have your independent school be a part of the community.
Great information. Thank you, Andy and Dean. Before you exit the webinar, please take a moment to complete the brief questionnaire that appears so we can address any feedback you have for us. Again, we will send out the presentation slides to all attendees by tomorrow afternoon. Any further questions can be sent to info@corpfin.com. Thanks for your attention, and please enjoy the rest of your day.